Hi, my name is Dr. Michael McBride. I'm a chiropractor. I practice in the island of Maui and also have practices in 4 other countries. I work in Germany, Austria, Switzerland, and Japan. I originally was a yoga teacher here on Maui in the 70s, and that motivated me to go to chiropractic college. I graduated in 1985 from Palmer College of Chiropractic West, and I've been practicing on and off since that time. I want to present in this video some simple lower back exercises that can help you maintain your spinal health. So in this video, I want to share with you some secrets and also some techniques that you can do for yourself to help alleviate the lower back problems. It's not just physical; it can also be, having to do with your mental and emotional state. My work called somatic energetics works a lot with light touch and working with the nervous system and clearing the blockages within the nervous system. These are also manifested in the physical spine. And so I want to include all those different elements so you realize that it's not just your back hurting, it's also what's going on in your life. My work goes much deeper than just the physical. It touches into the mental, emotional, and spiritual aspects of the nervous system. And many people come to me with the same problem. Lower back pain is probably one of the biggest problems in our modern society. And I wanted to share with you in this video something that you can do for yourself that you can do on a daily basis that helps prevent you from having back pain and also to increase your flexibility and freedom from injury. So I want to explain a little bit about how the nervous system and the spine and the muscles are all interrelated. And I'll show you on the spine what this exercise does and what the goal of this exercise is. I want to explain a little bit about the anatomy of the lower back so you can better understand how it gets hurt and how we can help to relieve the pressure in the lower back. So first I want to show you, this is the body of the vertebrae. This rubber thing, it represents the disc. And then you can see also the yellow thing coming out, that's the nerve root. And then also, if you look to see this joint here, there's one on either side, and that is the facet joint. Now the facet joint is there to help guide the movement and protect and stabilize the lumbar spine. Now what problem develops is that people are moving improperly and they're moving their lower back in a way that it's not supposed to move. So what happens is it gets injured. You either injure the facet joint or you damage the disc. And then what happens is this area gets swollen around the nerve root, and then people have pain either in their back or they have pain that radiates down the leg or into the hip. So oftentimes where it hurts is not where the problem is. You feel it in your leg, but it's actually coming from the nerve root being irritated. So this exercise will be focused on clearing that tension in that area so that you have freedom of movement, and the swelling and tenderness in this area will be reduced by reducing the pressure on the spot. Now, the lower back is designed to carry the weight of the body. If you look at the rest of the spine, you can see they're small at the top and get bigger and bigger towards the bottom. Okay, that's because more and more of the weight of the body is concentrated on the spine and it needs to be strong and stable. The lower back is not meant to be twisted. It's meant to just maybe do a little bit of flexion or extension. And what this exercise will do is it helps to flex the spine a little bit. So if you can see, if I flex the spine, it opens up the hole where the nerve's coming out. It also takes the pressure off the facet joint. And that actually feels pretty good. So I'll give you exactly a method that very precisely takes the pressure off at various levels. And it's something that's simple, it's easy to do, and it's very, very effective. And it's not dangerous. So I also want to talk about how your lower back is hurting. What did you do? When you sit for a long time, it puts a lot of pressure on the disc. And also if you're getting up from sitting and you twist, you could throw something out. So it's also important to see if the pelvis and lumbar spine are lined up. That's what the normal chiropractic would do, would be to somehow bring the spine into alignment again. So one of the big injury factors is when people lift and twist at the same time. People always say, oh yeah, I bend my knees, but then they bend it back at the same time. So when you bend forward, you don't want to do this. If you're picking something up, you don't want to bend in your back. Also, you want to make whatever you're lifting closer to you. A lot of times people will injure themselves and they were just picking up a pencil. But the problem is it's not the size or the weight of what you're lifting, it's how you're doing it. If they're twisting, bending, and lifting, that's where the injuries come, because you're not supposed to twist the lower back. The lower back's supposed to do this, bending just forward and back. The twisting can come up in the torso, but especially when you're lifting something, you want to get it close to you. I'm bending down, my back is still straight, and I'm lifting with my legs. Can you see the difference? This is how people do it improperly, or they do it properly. Okay? So it's not just physical injury to the back, it has to do with people's stress. I would say the pelvis area has to do with your foundation. Who am I? Who am I really? Am I doing what I think I should do, or am I living the life that I want to live? A lot of times that has to do with your role in your relationships or your job. It's like it's not separate. I don't just have back pain. I have something going on in my life that's affecting my foundation of who I am. So there's definitely psychosocial aspects to back pain. So I don't want to just look at the physical. I want to look at also the mental, emotional, and spiritual aspects of it. Where is your middle? Where is home? These are all issues of the lower back. Am I happy in my relationship? Am I happy in my job? So I can't give those answers for you, but I can help create some clarity in your system, and you can make a decision for yourself. My work, somatic energetics, is more about flexibility and awareness rather than bad necks and bad backs. I mean, people walk in, I just had someone walk in just now with a lower back problem, just spontaneously. She's going to come in and be our guinea pig. So it's about flexibility and awareness. If your back is flexible and you're aware of what's going on, you're not going to hurt yourself. A lot of times people are stiff and blocked and stuck in a certain perspective, and what happens is they make a wrong move and boom, their back hurts. And now we just had someone just show up, and we're going to pull her into the video and we'll take it from there. I'm going to show you how I work with somebody, and then we'll go off into what to do. So this is Diane. She just walked into my practice just out of the blue. She's a tourist visiting the island of Maui, and she offered to join us in this videotaping. And I just want to talk a little bit about what's going on. So your lower back's hurting?
Yes, always.
Always? Uh-huh. What do you do generally? You just get it adjusted, or what are you doing to keep it healthy?
I get adjustments pretty regularly,
Mm-hmm.
chin-ups, I call them, and then recently I've been doing some Tai Chi and Qigong.
Okay. All right. So I'm just going to feel her spine and feel what's going on. This is how I would approach someone who walked in my office just out of the blue. I feel some tension on the left side of her neck. I can feel also she has quite a curve in her back. You can't see it from your side. Could you bring your legs up on the table? Thank you. Oh, it hurts. I can tell by the way you move. Can you see your back? There's a big kind of like hump here on the other side. Yeah. She has a bit of a scoliosis. That's a curvature in the spine. Okay, but her right leg is super short, almost an inch short. You can see it maybe there. Okay. Now the question is the problem in her lower back, or is it the problem in her neck? Could be either place. So can you turn your head, please? Just to one side, and then just set it down and relax everything. Okay. Now when she turns her head to the left, the short leg is gone. So that's really interesting. I want to turn the other side, please. And that goes short again. Okay, back to center. So this is one of the cases where the pain is not necessarily where the problem is. And that's one of the things with somatic energetics is I can ask a few simple questions and get a direct answer, yes or no. Can you put your left hand behind the small of your back? That doesn't change anything. Okay, put that back forward, and then the other hand behind the small of your back. Now when she does that, it evens out again. So it's telling me you can go back forward here. That's telling me that her fourth lumbar is also out of place. But the way the nervous system works is from above down, inside out. If there's like her atlas is out, which I felt the top vertebrae is out, it's causing downstream misalignment in the lower back. So I'm going to approach her atlas. She's right short. Make sure, yeah, right short. So I'm just going to touch a place where I can access her atlas. And I noticed I just very, very gently touched the right spot. And what happens is she started to breathe deeply. She just like immediately reacted. And that was hard for me when I first started doing this work. I used to do rack and crack and do everything in my office and just pop bones. Now I know more specifically how to approach a nervous system and how to change the internal workings of the nervous system. So when I'm touching here, I'm actually accessing up on the top. Now it's also interesting, I don't have to touch her the whole time. I can touch the point, it's like giving an impulse. And let's just let the body process what I've done. And it's just a very, very light touch. I also do move bones. I do, racking and cracking still, but I also do the preparatory work, which is a lot longer lasting effect. Now, besides doing a session on her, I'll also give her some, what I'm teaching here, the lower back stretch that will help her maintain, so she won't have to go every week to the chiropractor just to get popped. Yeah. Okay, so I'm going to check now to see what's going on with her leg. And now, if you can see, her leg is even now. And that used to really surprise me that I would do such a light touch and it would be such a dramatic effect. Now I'm going to test it. I'm going to put both hands on her lower back, just gently pulling down. And I can also go up to here where that pile of energy is stuck in the middle. So it's where you touch and how you touch. I'm pushing gently into the spine, also taking into account the facet joint as we talked about before. And then also here stretching above. Stays even. So she's ready to go to the next phase. I'm going to have her turn over. Can you roll over on your back? So I'm just going to touch on her neck very gently and pull up. That usually feels pretty good.
Wonderful.
Yeah, she likes. She like.
You like it. Relieves my headache.
Yeah. So a lot of times people will come in with a certain complaint, oh, my back hurts. But I kind of look at the whole system to see what's going on. If I just focus on her back pain and just at her lower back, it might feel better for a little while, but then it will just come back because the real source of the problem has not been addressed. And it's probably between the ears, yeah? The way you think. We all have that challenge. And it's just a gentle pressure. I'm just pulling very, very lightly up on the neck, tractioning a little bit. Good. And the way I know it's working is I can see that the breath is getting more pronounced. She's breathing both in the belly and the chest. Okay, now I'm going to do a little demonstration on the stretch. I can do the stretch for her, and then later I'll describe how you do it for yourself. This is the beginning position where the legs are up. And what that's doing, like I showed you before, this is like how she's laying. What you're doing is you're stretching the lower back just like I was showing you on the facet joint. You're opening up the nerve holes where the nerve comes out. You're also stretching open the facet joint. And that takes pressure off the nerve and it feels good. So I can do it for her. So this is the action I'm going to do. But what I do is I just do it slowly. And I'm feeling for where the tension is in her back. This is like the L5 disc between L5 and sacrum. Doesn't that feel good? It's different when an expert does it. Okay. And now I just let her breathe a little bit in that spot. Okay. And then I'm going to bring the legs up a little more. As I go up, I'm going up the spine. Now I'm about the L4, L5 disc. It feels not so bad. Her mainly, I could feel the L4 and the L5. Yeah. Right about there, yeah. So, and then I'm going to move up. As I go up, I'm going up the spine. Now it's pretty loose in there. It doesn't feel like too much. And then maybe a little higher. Now, especially when someone has acute pain, I don't just let go of her legs. I bring it down slowly to gradually put the pressure back on the lower back. And this is also when you do it for yourself, you want to pay attention. The exercise itself is almost like it's like an awareness exercise, because you're trying to tune into where those areas where you have pain in your back and stretch them out really gently and specifically. It brings focus to those areas of your spine. Okay, I can also go underneath her sacrum. That's what I'm going to do now. My hand's right here. I'm going to roll her this way and just drop into me. Don't have to hold up. Doesn't that feel good? Yeah. Well, what I'm doing is I'm floating the sacrum between the two bones of the hip, the two hip bones. And then
Oh man, that releases tension.
I didn't pay her to do that. I know it works. Now I have to be careful myself when I'm bending forward. I'm being comfortable with myself. I spread my legs apart. My back is pretty straight. Most of the bend's in my knees.
This seems much better than bridges.
Well, that's a more, doing the bridge exercise like from yoga is a more advanced stretch. I wouldn't do that for someone who's got, there are things that are appropriate for you where you are, and maybe as you get better, you can do more advanced sort of things. And that's why I teach this one exercise today, is because anybody can do it. I would say 99.9% of the people that come with lower back pain have relief by doing this exercise.
Feels better already.
Thank you. Yeah. So if you're going to do it yourself, what you do is you do one leg at a time. You bring one leg up, and you leave this leg up. What most people do is a mistake. The leg is straight, and then they go like this. See, that's tension, okay? We don't want tension, we want relaxation. So I bring the leg up, and then we do it, and it feels like relaxation, see? And the same idea, I kind of go, you can also go a little bit side to side. It's not so moving the leg back and forth, it's finding that place of focus where you have resistance, and then breathing into that. And it's like each breath brings a little relaxation in. Okay, good. And then you can go a little higher. There's another spot. I know where it is because I can feel the tension in her leg. I can feel where the resistance points are, and that's where she needs to work. Sitting on a plane, flying here from wherever you came, it's a long time sitting in a plane. I fly about 100,000 miles a year, so I do this exercise myself. Okay, and then the leg comes back down, and then you do the other side. Don't help you after this, relax. Yeah, I got you. She's trying to help. Now this side feels a little more tense. Yeah.
I would say it could be the hip replacement part.
Yeah, this also works with someone who has had surgery or has had hip replacements. There may be limitations depending on what kind of surgery you had and how talented your surgeon was. I've also had people that have had hip replacements and it was not the problem, so it didn't fix it. Yeah. But also some people are in so much pain that a hip replacement is appropriate. And you have to decide with your surgeon. See, feel that tension in? Boy, that really, really does not like this, okay? So part of this also is not to force the stretch. You go to a place where you're willing to accept the stretch, and then as you practice, you'll become more and more flexible and breathe and relax. Yes. Very good. So, and both together. And what most people will do when they do this exercise is they want to go all the way to the top right away. And I'll demonstrate the wrong ways to do it. I won't do it on her because it'll hurt her. It'll hurt me too. But I'll show you the common mistakes people make. Like I'll send someone home with this exercise, and then they come back and say, "It's not better. What's wrong?" Okay, show me what you're doing. And then they're either doing with the leg down, or they're bypassing all the points in the lower back and just pulling to the top and creating tension as opposed to releasing the energy. It has to be done with awareness and focus and breath. So the best answer to the question, is it helping or hurting? What are the results you're getting? What are you feeling? If it's not getting better, maybe we need to do something different. And see, I don't really have to structurally adjust her back. Yeah, I can, but I don't think it's necessary. I think this stretch and also getting it was actually the atlas that was out. I was able to determine that the atlas was with the problem. It wasn't, this is more a symptom of what's going on top. Yeah, yeah. And there's also, psychological, emotional, and spiritual aspects to the misalignment. So atlas is worry about the future. C2 is about control, head and heart. And the sacrum is like the question, who am I? And how you answer that question. Am I following what my heart wants to do or what my head thinks I should do? These are all aspects of the work. How you doing?
Better than when I came in.
Well, that's the idea. But sometimes when you're having a back pain, it's not an A to B kind of experience. It may take time for you to resolve. And this is just kind of a brief example of how I work. Normally, I would see someone. We do group sessions. I have 6 tables in here, and then I do contacts where, like I touched you, and you have that time in between to relax and to breathe. And people have different experiences. They may have memories or feelings come up. I work in Japan also, and then I'm doing like 24, 26 tables at the same time, and it gets pretty wild. Oh, I already have 16 practices. I'm a little overextended already. Oh, thank you, though. I appreciate it. You'll have to come visit me here.
I'd like to. I need a good real estate agent.
About every other person in Maui is a real estate agent, so this shouldn't be a problem. Okay. So thank you very much, Diane. Thank you for coming.
I enjoyed it.
Yeah.
I hope things go well for you.
I'm just following my star.
Mahalo.
Mahalo. So I'm going to go over the exercise now. You understand the anatomy behind it, and you've seen one of my spontaneous clients show up, and I demonstrated on her. So now I'm going to show you on the table. You start by laying on your back, and I have my knees up. This is the beginning position. And actually what I'm doing is I'm taking that curve in the lower back and flattening it against the table. And I can also rock my pelvis without even raising my legs. So what I'm doing is I'm contracting the abdominal muscles, and I'm causing like a tilt in the pelvis. That's one thing you can do to start. If your back is really bad and you're really hurting, that might be enough. Okay, so then the other part is I'll bring one leg up, and I'll try and focus on where I feel tension in my lower back. And once I've got the focus, then I breathe. Yeah, so that's it. Breathing and relaxing. So like each breath brings a little more relaxation to the muscles around the spine and taking the tension out. Okay? So I did maybe 3 to 5 breaths in one spot, and then I'll try and focus on another spot. I find another spot where I feel tension. Now I'm not pulling hard with my hands. The hands are there just to kind of support the leg and so it doesn't feel lonely. You don't pull because you don't want to take and put the pressure in your shoulders. The shoulders are neutral. It's just there to kind of make it a little more stable. And then breathe. Now notice the knee is also bent. I can go above the knee like this, or I can go behind the knee. It's a slightly different stretch. And just follow what you feel. And that's what this exercise is about, is tuning into your back and finding those places where you need to release tension. Breathing, relaxing. Okay, then you can bring the leg back down, and then you can do the other side. Now one side might be more tense than the other. For me, I feel mostly on the right side. Now, I had a disc injury several years ago, and my L4, L5 disc is about 50% of the height of the normal disc. So I need to do this myself every day. I also practice what I preach. It's important for me to keep my disc free and moving, combined with the X. Now, I'm not really pulling with my hands, just very slightly, and then also this way. So if it's really, really tense and painful, you may want to go back and forth a couple times and breathing, 3 to 5 breaths. And then you do 2 legs at once. Now notice I'm starting pretty low. This is lower on the spine. This is right about the sacrum and into the L5 sacrum disc. Making sure to breathe, that's what people forget. And don't put the tension in your shoulders. You're not raising your head. You're relaxing, everything's relaxed. Just a gentle stretch. And then I move up a little bit, that's more the L4-5. I can also contract the belly muscles to help aid in the breath, in the angle of the sacrum. And then I go up higher. And one of the common mistakes is that someone will just go right to the top and they're doing more tension. And that's not relaxation, that's tension. We want relaxation, not tension. And don't forget, the neutral leg should be up, not down. This puts tension in the lower back. Okay, when I was 26, I could do that. I'm 69 now, and I have to be a little more conscious of how I use my lower back. I'm less flexible than I used to be when I was 26. And then this. Now, if you do this correctly with the breath, it's probably about 3 minutes. So I can describe it as like a 3-minute vacation for your back. If you do it 3 times a day, that's less than 10 minutes. And your back's going to be more flexible, it's going to be less painful, and you're less likely to hurt yourself. Or if you're having a lot of pain, it's safe. You can do it every 20 minutes if you need to. Especially with people that are in acute phases of disc injury or facet syndrome, where there's a lot of back pain and maybe pain down the leg, or numbness or tingling. I would have them do this exercise every 15 to 20 minutes, and then spend a lot of time just on their back, relaxed. And your back pain will tell you what's right and what's wrong. The question is, what is the results? What are you feeling? Follow that, what brings more relief. Don't force yourself into tension or to try and fix it. Just breathe gently and let the stretch do the work. Now, when you're done, you want to roll on your side and then push up, so you're not taking more tension in your back. Okay. So it's simple, it's effective, and it's not dangerous. Now, many people will come to me and they say, well, my physical therapist said to do this, and they show me the stuff, and I go like, no, you don't want to do, like you're laying down and you're raising your leg up. I mean, later on, maybe when you're not in an acute phase, but if you're extending your leg, that's a lot more weight. If the further away your leg is from the center, the more it weighs, and that's more tension on your back. That actually is hurting my back. I don't want to do that. Also, they're doing stuff where they're twisting their back. And like I described earlier, the lower back's not meant to twist. That's a more advanced type of stretch, and that would only be done when you're out of the acute phase. And monitor how you're feeling. How does it feel? Oh, it kind of hurts. What is other mistakes? Just going to the top. You don't want to do that. You want to relax. It's like an awareness exercise as well, because you're learning where your back is sore and how you can relieve that tension. Now I can also go up like this. That's kind of from my yoga phase, but when you're in the acute phase, I wouldn't do that. I would lay on your side and push yourself up with your arms. So many times people will come back to my practice and they say, well, it's not getting better. What's wrong? So I have them show me what they're doing, and oftentimes they're making one of the mistakes, or they're not doing it at all. You know, how often do you do it? Well, once a week, every once in a while. Well, I think it's important for you to have a routine where you, at least 2 or 3 times a day, that's less than 10 minutes, and you'll be a lot less vulnerable to injury, because if you're flexible, you can make wrong moves and your back isn't destroyed. So flexibility, awareness, focus, breathing, these are all parts of the exercise as well. So 10 minutes a day or less, or you can just come see me more often. It's like, I don't need the business. I want to help you. I want you to get well and take care of yourself, and I'll help you along the way. I thank you very much for your interest and for sticking to the end of this video. I also want to do one more thing. Okay, so a few years ago, I wrote a book called Somatic Energetics: Heal Your Back Pain and Transform Your Life. It doesn't tell you how to do my work, somatic energetics, but it helps you to understand the background of it, and also I describe many of the experiences I've had over the last 20, 30 years of working. And there's more to it than just mechanical stress. There's also emotional and mental and spiritual as well. There's some great pictures in there, stories, a few things to do about reducing stress. Also, this exercise is in there. It's been translated into German and Japanese. And if you have a chance, find a copy somewhere. I can send you one. So if you're interested in learning more about somatic energetics or experiencing sessions, or actually I give trainings to people who are not necessarily doctors. I teach also all the energetic work. You don't have to be a doctor to learn this work. And I teach in various places. I teach also in German. I speak German fluently. Several locations in Germany. I also teach in Japan and also on Maui. So come have a vacation. So I would like to encourage you to find my website. It's somaticenergetics.com. That talks about where I'm going to be when. And I have many people that show up and follow me wherever I go. So I wish you much mahalo and aloha.